All righty. Good morning, everyone, and welcome again to the SHIPSMP volunteer webinar. Today, we are going to be focusing on our Medicare Coordination of Benefits. I'm Sydney Shutro, the State SHIP Volunteer Program Coordinator here at the Tennessee Commission on Aging and Disability. So thank you all for being in attendance today. We had 58 volunteers RSVP, and I know we're going to have a great and lively discussion. We're going to have a lot of questions throughout the webinar, so please feel free to type those into the chat box as we go. That way I can kind of answer questions as they come in rather than at the end of the webinar when we've been through all the information and we kind of have to remember what we talked about. So feel free to use that chat box to answer those or ask those questions.
Where is that chat?
Okay, and I'm also going to ask everyone to mute their phones if you're able to, and I'll be looking kind of to see who's talking so I can mute you as well as I'm presenting, but just want to do that reminder as well. So when we talk about coordination of benefits, it's really about, is Medicare going to be the primary payer or is Medicare going to be the secondary payer? That's what we mean when we talk about coordination of benefits. So in terms of Medicare being primary, we're getting some background noise, I'm sorry, I'm trying to figure out who that is. In terms of Medicare being primary, Medicare will be primary if you have no other insurance other than Medicare. Medicare, of course, is going to be your primary. Medicare is secondary if you have other insurance that Medicare is not responsible for being the primary for. So examples are employer insurance and things like that. So we're going to get into more examples. But other insurance that's going to pay first, Medicare may pay secondary depending on what kind of insurance you have. And then there's also the possibility that Medicare is not going to pay at all if you have certain other health insurance that are responsible for paying for certain things due to your, in regards to your health care. And we're going to talk about all three of those examples. So the examples of when Medicare is always, no questions asked, going to be your primary payer is, again, if you have Medicare only as your insurance, if you have a Medicare supplemental plan. So that's with original Medicare only, and you have that supplemental plan to cover the 20% Medicare doesn't pay. Medicaid is always the payer of last resort, so Medicare is always going to be primary. Any retiree benefits you have from a former employer, Indian Health Services, VA benefits or Veterans Administration benefits, TRICARE for Life, or COBRA, Consolidated Omnibus Budget Reconciliation Act. I can never say that word. Or in short, COBRA. So we'll talk about all those throughout the presentation today as well, but just remember if any of those insurances come up, Medicare is always going to be your primary payer. These insurance providers are going to be secondary to your Medicare. A great resource that we all have access to is the Benefits Coordination and Recovery Center. So if we have any investigating that we need to do on behalf of a beneficiary who maybe their provider is billing the wrong insurance as primary, we're going to contact the Benefits Coordination and Recovery Center. They're the ones who do all of that investigating and identify which health insurance provider the beneficiary is responsible for the primary payer. I have the toll-free number there, the 1-855-798-2627 number. And what we're able to do as SHIP counselors, if you're staff or you have been trained as a level 3 counselor, meaning you've gone through the 2 full-day training with SHIP, you're able to request a unique ID so you can talk on behalf of a beneficiary and you don't have to do like a 3-way call or anything. So if you have a SHIP unique ID or if you want more information on a SHIP unique ID, please let me know. But you're able to call that number for Benefits Coordination and Recovery and actually talk on behalf of the beneficiary without them having to be on the phone with you. So it's kind of like you're an authorized representative, but you don't have to fill out the paperwork or anything like that. So if you don't have that and you want one, please let me know and I'll see what we can do to get you one. So we have a lot of resources at our disposal to help our beneficiaries. So we're going to talk about 12 different possible health care claim payers. I'm not going to read all those to you, but these are the 12 that we're going to focus on today. We're just going to go one at a time, and if we need to go slower, let me know. Remember to type in those questions as we go along as well. So the first payer we're going to talk about is Medicare in the Marketplace. Marketplace is also known as the Affordable Care Act Marketplace. Some people may refer to the Affordable Care Act as Obamacare, but when you have your SHIP counselor hat on and you are representing the SHIP program, we want to make sure that we refer to it as its name, the Affordable Care Act or the Affordable Care Act Marketplace. So we don't use the Obamacare shortening, we use the Affordable Care Act. Medicare and the Affordable Care Act Marketplace are completely separate. They do not work together. So if you have Medicare Part A, premium free, meaning you don't pay that high premium, you worked all your quarters, you do not qualify for the Affordable Care Act Marketplace. The Affordable Care Act Marketplace was designed for people who are uninsured, who have no access to insurance. And if you have Medicare Part A premium free, you are considered covered when it comes to the Affordable Care Act law. So it doesn't matter if you get it through Original Medicare or the Advantage plan, you are covered and you will not be eligible for any kind of premium credits or reduced cost sharing that's involved in the Affordable Care Act law. It is illegal for someone who is selling a marketplace plan who knows that you're on Medicare to sell you a marketplace plan because you wouldn't qualify. The marketplace is not considered credible coverage with Medicare. Some people that we run into, and I know many of you have come across these beneficiaries who are currently on the Medicare marketplace and are enrolled into what they refer to as a qualified health plan or a QHP, and they're transitioning into being eligible for Medicare. So maybe they're turning 65 or they're on Medicare due to a disability. So they have that marketplace plan as they're transitioning onto Medicare. It's very important for us to make that beneficiary aware that they need to cancel that marketplace plan and make sure that they are enrolled into Medicare and no longer have that marketplace plan. As I mentioned before, Medicare and the marketplace are completely separate, so there is no coordination of benefits between the two. The marketplace will never be secondary to Medicare. Medicare will never be secondary to the marketplace. Two completely separate insurances that do not work together. The only exception to that rule is if a beneficiary has insurance through an employer and the employer gets the insurance through the marketplace, but that's a completely separate issue that we're not going to have to worry about. If you stay enrolled into your marketplace plan when you're eligible for Medicare, again, it is not considered credible coverage, so you could be assessed a late enrollment penalty if you do not enroll into your Medicare Part B when you're first eligible. So again, it's extremely important that if you're talking to a beneficiary that is currently on the Affordable Care Act Marketplace and they're getting ready to go on to Medicare, that they cancel that marketplace plan and their insurance, they need to, enroll into Medicare. The only exception to this rule is if a beneficiary has to pay a Part A premium. It's very rare. About 1% of the Medicare population has to pay a Part A premium, and that's because they have not worked and paid into the Medicare tax or the FICA tax for 10 years or 40 quarters. Then you have a Medicare Part A premium to pay. If that's the case, they would qualify for the marketplace plan and be eligible for subsidies. So getting their premiums reduced by tax subsidies and have that cost sharing reduction. However, if they wanted to enroll into Medicare in the future, again, the marketplace is not considered credible and they may have a penalty in the future. So the marketplace in Medicare can be a complicated thing to coordinate and to counsel a beneficiary on. And just remember, for any complicated cases that you have, it's okay to tell the beneficiary, I'm not sure what the answer to that is, let me do some research, or I'm going to refer you to my coordinator, and you can refer them on up to your volunteer coordinator, the program coordinator, or you can feel free to refer them or ask me questions if you have any about a beneficiary's particular situation in terms of coordination of benefits, or any other Medicare question that you may not know the answer to. All right, so that's Medicare in the marketplace. So I'm looking at the chat box, and we have no questions at this time, so I'm going to keep going. Retiree coverage is the next coverage that we're going to talk about. So there are some employers that after the person has retired from the company, they offer some form of retiree benefit. It could be an employer-sponsored Medicare Advantage plan benefit, or it could be we're going to pay whatever Medicare doesn't pay. Depends on the insurance that the employer offers. I strongly encourage everyone, if you come in contact with a beneficiary that says, yes, I have retiree coverage through my employer, that you tell the beneficiary to talk to their benefits administrator and see how that retiree coverage works with Medicare. The biggest example that I have that we with SHIP work with almost on a daily basis, and I'm sure the coordinators can back me up on this, State of Tennessee retirees, they have a specific retiree plan called POMCO, P-O-M-C-O, and that's offered through the State of Tennessee retirees only. Just because we have so much experience with it, we know that that is an excellent retiree coverage that beneficiaries should take advantage of. But in terms of other employers across the state, there's so many that offer retiree coverage, there's no way for us to know exactly what all of the benefits of a retiree coverage are. Most retiree coverages come with credible drug coverage. That is, a retiree drug coverage is considered credible with Medicare. So if they were ever to lose their drug coverage, the beneficiary would have 63 calendar days to enroll into a Medicare Part D plan, whether that be a standalone drug plan or through an Advantage plan. They have 63 days from when their retiree drug coverage ends to enroll into a Medicare-sponsored drug plan. And there is some caution to beneficiaries saying, no, I don't want my retiree coverage. Because if they deny coverage, they could, whether it's drug coverage or the whole retiree package, they may not be able to ever get it back. So we definitely don't want to encourage beneficiaries, oh, Medicare is going to be better than your retiree plan, because we don't know. So the beneficiary really has to help and do the research of what are the benefits of your retiree plan. We can give them all the information about how much Medicare would cost if they wanted to go with original Medicare or a Medicare Advantage plan, but they should consider what the benefits are of their retiree policy. It's not our decision to say you need original Medicare or an Advantage plan or your retiree coverage. It is completely up to the beneficiary what insurance they want to enroll into. However, we do need to tell them that if you don't enroll into your retiree coverage, you may not be able to enroll in the future. And also it could result in family members possibly losing their coverage. So there's a lot of key factors for a beneficiary to consider when they qualify for a retiree benefit. All right, looking at questions. We don't have any questions coming in yet, so I'm going to keep on going until we get some questions. Employer group health plans, we talk a lot about this when you come to the initial 2-day training to become a SHIP volunteer, that if your current employer, meaning you are actively currently working, you are going into the office, you are actively working, whether it's between your insurance or a spouse's insurance, you may not want your Medicare right away if you're Medicare eligible and you're continuing to work. You can choose to keep or reject the employer plan. 9 times out of 10, the employer plan is probably going to have more comprehensive benefits and have a cheaper premium than what Medicare has. Especially when it comes to the drug benefit, they're probably going to have a lot better drug benefit through their employer group health plan. Businesses with fewer than 50 people may qualify for the Small Business Health Options Program through the Affordable Care Act Marketplace. That works just like regular employer insurance as long as they're currently actively working. So when does Medicare pay first? If you're 65 or older and have retiree coverage, so you're no longer working and they offer you a retiree policy, Medicare is going to pay first. If you're 65 or older, so I'm 65 and I'm going to continue to work after I'm 65 because remember 65 is the magic number for Medicare. That's when you age on to Medicare. 65 or older with group, employer group health plans through your current employment or your spouse's current employment. If the employer has less than 20 employees, Medicare is going to pay first. If they have more than 20 employees, Medicare will be secondary if you enroll into Medicare. If you're under 65 with a disability and have employer group health plan, your current employment, if the employer has less than 100 employees, Medicare is going to pay first. I honestly could not tell you what the significance of the 20 employees and the 100 employees is. I've tried to do some research and I haven't really been able to come up with a concrete answer. So I'm not sure if you have questions of why 20 employees, why 100 employees. I can honestly tell you I don't know the answer. I can do more research on it and ask some people, but I've come up short during my research. And the last one, they're eligible for Medicare due to end-stage renal disease, and you have employer group health plans when your 30-month coordination period ends. We don't talk a lot in our initial training, well, we don't talk at all really in our initial training about people who are on Medicare due to end-stage renal disease. So basically, when someone is eligible for Medicare due to end-stage renal disease and they have employer coverage, for the first 30 months that they're on Medicare, the employer is always going to be primary. After that, if they're on Medicare due to end-stage renal disease, after month 30, then Medicare becomes primary. So that might be another webinar topic just about benefits people with end-stage renal disease have when they're on Medicare. But that's what they refer to with that 30-month coordination period ending. Alrighty, and that was the employer group health plan. This next one, and I don't have any questions in the chat box, so we're going to keep going again. Again, please remember to chat in your questions as we're going through. We can open it up for questions probably toward the end of the presentation, but chatting your questions as they come up would probably be the best. This next one is becoming more and more popular across the country. These are health savings accounts. A lot of employers are starting to offer them as health care coverage for their current employees. So some of you may have come across a health savings account beneficiary. And what this means is it's a separate account that has a high deductible, but beneficiaries and an employer can contribute monthly to this savings account. For example, in the state of Tennessee, my employer contributed $500 to a health savings account and $50 a month in addition to that. And then if I were to enroll into the health savings account, I could make a contribution tax-free to that health savings account to help pay for qualified medical expenses, like my co-pays, maybe some premiums, things like that. So a lot of the times we're going to see employer-sponsored health savings accounts, but individuals can also have a health savings account that may be overseen by their bank or maybe their financial planner, insurance company, things like that. What's important to note is that if a beneficiary enrolls into any part of Medicare, A, B, C, or D, A, even though it's premium-free, it makes them ineligible and they can no longer contribute to that health savings account. The beneficiary cannot contribute, and the employer can no longer contribute to that health savings account. You still are able to use the money that's in that account. So if I retire and I had $10,000 in my health savings account, that does not go away. I get to keep that money to pay for my qualified medical expenses. However, once I'm eligible for Medicare and at least enroll into Medicare Part A, I can no longer contribute and add money to that $10,000 health savings account. If you're still working and are covered by the group health high deductible plan, the beneficiary can postpone Medicare enrollment. So you don't have to enroll into Medicare right away. It works just like an employer group health plan, where if you're actively working and that insurance is considered credible by Medicare, you don't need to enroll into Medicare right away. In terms of a health savings account, you don't want to enroll into Medicare Part A either. Normally, we tell beneficiaries on group health plans to enroll into Medicare Part A because it's free. You get secondary hospital coverage. Health savings account beneficiaries, that does not apply. We do not want them to enroll into any part of Medicare, A, B, C, or D, no enrollment. They also need to make sure that any drug coverage they have through their high deductible health plan is considered credible with Medicare to avoid any kind of penalty. So why are we talking about this? Why is this so important? It's brand new. There is a complicated twist to the health savings account. So for a beneficiary who says, I'm getting ready to enroll into Medicare, they need to stop contributing anything to their health savings account 6 months before they decide to either collect Social Security or to enroll into Medicare Part A, B, or any part of Medicare. The reason why they have to stop contributing 6 months before they get on Medicare is because Social Security is going to retroactivate their Medicare Part A 6 months. So if I were to enroll into Part A now and I don't have it, I'm 70, whatever, they are actually going to start my Medicare Part A December of 2017 because that's 6 months back. If you do not stop contributing that 6 months before you apply for Social Security or have your Medicare Part A, that beneficiary is going to get a tax penalty on that health savings account. Now, I don't know what that tax penalty is. I've tried to do some research, and I haven't been able, again, to find a concrete answer. But whoever prepares that beneficiary's taxes should be able to tell them what that penalty is going to be on their health savings account. Okay, and that's health savings accounts. It's not super in-depth, but I really want to drive home that if you come in contact with a beneficiary who has a health savings account, they really need to stop contributing 6 months before they're eligible for Social Security or Medicare, because once they enroll, that Part A is going to be retroactive 6 months, and however much money they've contributed in that 6 months could have a tax penalty associated with it. So I know that can be complicated. I don't see any, oh, here we go. What about SSA, same rules as HSA? I'm not sure what you mean by an SSA. So if you could, as far as I know, these rules only apply to a health savings account and no other account. But if you could let me, flexible spending account. Oh, okay. No, this does not apply to a flexible spending account because flexible spending accounts can be used for many different purposes. They could be used for child care or parking expenses or kind of a whole gamut of things. And it could be used towards your health care benefits as well. But since there's so many ways you can use those accounts, it does not have the same rules as a health savings account does. The health savings account is specifically designated for health care expenses. So to answer your question, no, it does not have the same rules as the health savings account. Another question, if someone is just turning 65, do they need to stop the deduction 6 months prior? Yes. If they're turning 65, and, well, I guess that's not necessarily a yes question. There can never be a concrete answer, can there? So if they're just turning 65 and they're continuing to work and they're not going to enroll into Medicare and they're not going to get their Social Security benefit, then no, they don't have to stop 6 months before. However, if they're turning 65 and they want to enroll into Medicare at age 65, then yes, they do need to stop deducting 6 months prior. Basically, they have to stop adding money into their health savings account 6 months before their Part A is going to be effective or 6 months before they're going to receive their Social Security benefit. Social Security benefits automatically enroll that person into Part A. So whenever those two are coming up, 6 months prior to, the beneficiary has to stop contributing to that HSA. Another question came in. So if they have a health savings account and still have, say, $2,000 in it that they have not spent, can they go ahead and use it but just not contribute to it? Yes, absolutely. So that $2,000 is theirs to keep, and they just spend that down through their medical expenses. Some examples of expenses you can use the health savings account for are any co-pays, the 20% Medicare doesn't pay, deductibles, and possibly some premiums. I'd have to double check and see which premiums are eligible for the health savings account. I know Medicare supplemental plans premiums are not expenses that you can use a health savings account for, but I will double check and see about the Part B as in boy and Part D as in drug. But great question. All right, I don't see any others, so we're going to keep on going. Federal employee health benefit. So this is specifically for federal employees. I am currently a state of Tennessee employee. I do not get federal employee benefits. So these are anything like the Postal Service and employees like that. It works just like employer coverage if the beneficiary wants to work past the age of 65. So they have the option to continue the employer coverage if they're an active employee. However, when you retire, federal employee health benefits, they strongly encourage you to enroll into Medicare Part A because it's free. It is your decision to enroll into Medicare Part B or not. So if the beneficiary does enroll into Part B, Medicare becomes primary. Federal employee health benefits will be secondary. If the beneficiary does not enroll in Medicare Part B, then federal employee benefits will continue to be primary insurance. However, if the beneficiary does not enroll into Part B when they're first eligible, they can only enroll during the general enrollment period, which is January 1st to March 31st, and they will be subject to a Part B penalty if they need Part B in the future. So it's just like any other employer health plan. If you don't get Medicare Part B once you retire within that 8-month period, you will be subject to a Medicare Part B penalty. And I got that information directly from Medicare Interactive. So if you all haven't looked on Medicare Interactive's website, they have a lot of really, really great resources when it comes to federal employee health benefits and many other topics regarding Medicare. So federal employee health benefits can include dental and vision care that we all know Medicare, original Medicare, does not cover. So it's important that the federal employee make sure that they know what's in that retiree benefit package. So again, talk to their benefits admin or their HR person and make sure they know the benefit. And if they want to enroll into a Medicare Advantage plan on Medicare's open market, they need to talk to their retirement office about suspending their federal employee health benefits enrollment. So it doesn't sound like, and from what I've read, it doesn't sound like there is a coordination of benefits between Advantage plans and federal employee health benefits. So that's something to know if someone who has and is eligible for a federal employee health benefit, they're interested in an Advantage plan, they're not going to be able to use their federal employee health benefits when they're enrolled into that Advantage plan. And all prescription drug coverage through the federal employee health benefits is considered credible, so they do not have to enroll into a Medicare drug plan. They're not going to be charged a penalty for it, and they do not need to enroll into one. And I also put in 2 links to some very good, there's that Medicare Interactive link, and directly to the, I can't remember what it was, Office of something management. Skipping my mind.
Office of Personnel Management.
Thank you. Much appreciated. Office of Personnel Management. That is through the government, so there's a great link for more information there as well. And also in the email that I sent you with all the materials for today's webinar, there is a fast tip sheet for federal employee health benefits. So some even more resources for you there. Alrighty, there's no other questions that come in. So non-group health plans. So these are insurances, say through your auto insurance, your homeowner's insurance, black lung benefit program, third party, workers' comp. It's not necessarily a health plan that's through an employer, but through a different source. And we're going to talk about all of these next. So for example, with no fault insurance, again, include your auto, homeowners, or commercial insurance plans. These plans pay regardless of who's at fault. So if I'm in a car accident and it's not my fault, I get rear-ended by somebody, it doesn't matter whose fault it is, my no-fault insurance, my auto insurance is responsible for the health care. Medicare is secondary payer. So I would have to send all of my medical bills for whiplash or whatever happens during my car accident to my auto insurance, and they would be paying primary. If there was some left over, I could bill the rest and send it over to Medicare to see if they would pay it. But Medicare is not going to pay primary unless the plan, my auto insurance has not paid the claim within 120 days after the accident took place. Then Medicare may make a conditional payment, but Medicare is going to be expect to be repaid by my auto insurance for what they paid out because they were not supposed to be primary. So I've had a couple cases like that where I've had to work with Medicare and a no-fault insurance company to make sure the no-fault insurance paid that claim. Liability insurance, same thing. If anything happens due to negligence, inappropriate action, or inaction, any medical expenses coming from that has to be billed to the liability insurance first. Medicare will pay second if there's any additional costs. And then, again, if the liability insurance payer won't pay promptly within the 120 days of the incident, Medicare may pay, so the beneficiary isn't responsible for the bill, but Medicare is going to expect that liability insurance company to repay what they've paid on their behalf, since Medicare should be secondary to that liability insurance. Workers' compensation. So this, if I'm injured on the job, let's say I fell and I hurt my back and now I have, slip disc, something along those lines, and I need surgery. Medicare is not going to pay for anything related to my injury that I got at work. So my surgery for my spinal fusion or my slip disc would have to be billed through workers' compensation, and Medicare would not pay anything for that. If workers' comp denies the claim, it could be filed with Medicare, but there's going to be a lot of paperwork associated to that to prove to Medicare that what's being billed is not due to the incident that happened while you were working that should have been billed under workers' compensation. Same thing when you bill something to workers' compensation, there's going to have to probably be a lot of medical paperwork to prove that this claim is because of the injury sustained at work. And there's many ways that workers' compensation claims are resolved. They have settlements, judgments, awards, payments, all sorts of good stuff. We have had a couple cases where beneficiaries have gotten Medicare set-aside arrangements or workers' compensation Medicare set-aside. These are specific funds, whatever the settlement amount is, just for easy math, we'll say $10,000, just an example. So I got hurt at work, I went through workers' compensation, and they gave me a Medicare set-aside for $10,000. So that is to fund any injury, illness, or disease related to what happened at work, and it's only going to be used for Medicare-covered services. So Medicare is going to be billed. And the payments for what Medicare doesn't pay, I would take that out of my Medicare set-aside arrangement, and then once my funds were used up, then Medicare would pay primary. So Medicare is going to pay, and then it just gets funded out of my set-aside until that money is ran out, and then it goes just like a normal Medicare beneficiary's payment. We do have a question, where will the receipt go to get assistance with that type of claim paperwork, workers' comp that transfers to Medicare? It will be the beneficiary's responsibility to get the paperwork from the provider if the claim is denied. Most of the time, the provider, you'll say, this is due to my injury at work. Here's my workers' compensation insurance that I received. Bill that to workers' comp. Provide some medically necessary paperwork just to make sure it doesn't get denied. But that will be done through the doctor's office. If it is denied, then the beneficiary would have to go through the appeals process and submit that paperwork to get that claim approved under that workers' compensation. Okay. Any other questions? Please feel free to type those into the chat box. The next one is Federal Black Lung Benefits Program, and this is specific to anyone who worked in coal mining and has been diagnosed with black lung disease. All of those medical bills and claims having to do with that black lung disease is going to be fully covered under the Federal Black Lung Benefits Program. Medicare will not cover any of those medical costs because that should be billed directly to that program. And if you ever need to contact that program or get more information on that program, there are the phone numbers there on that slide as well. So the COBRA, Consolidated Omnibus, how do you say that word, Budget Reconciliation Act. I'm just going to call it COBRA, so we all know what it stands for. Some beneficiaries are able to get COBRA from their either current employer or most of the time it's from a former employer that is very expensive. So the beneficiary is responsible for paying the entire insurance premium. Generally speaking, when you get insurance through an employer, the employer pays a certain percentage and the beneficiary or the employee pays a lower percentage. When it comes to COBRA, the person or the beneficiary is responsible for the entire premium. And generally it lasts for about 18 months unless there's other special circumstances through the employer. But it's extremely expensive and it's not considered credible coverage with Medicare. So if you're eligible for Medicare and COBRA and you opt to go into COBRA, the beneficiary will get a penalty if they enroll into Medicare later. So it's not considered credible coverage. So if you are 65 or older and have a disability, so either way you're going to be on Medicare, and have COBRA, Medicare is going to pay first, provided you enroll into it. COBRA could be secondary, but that's going to be a very expensive secondary insurance. Medicare will pay first over COBRA because COBRA is not considered credible. And there are some situations where employers will pay a portion of the premium for a beneficiary on COBRA. I've only come across that one time in the 7 years I've been with the program, so a majority of our beneficiaries would be responsible for that entire premium. If you have COBRA and are eligible for Medicare due to end-stage renal disease, COBRA is going to pay primary after that 30-month coordination period ends that we talked about earlier. VA, so the Veterans Affairs, Veterans Administration, for our military servicemen and women, they are also, just like the Affordable Care Act, two completely separate entities. Medicare and the VA rarely, if ever, work in conjunction. Now I'm going to talk about one example of how they do work in conjunction, but not necessarily due to payment. So if you have Medicare and the VA, great, you can get coverage under either program. So that means you can go to a civilian provider and Medicare will cover it, or you can go to a VA provider and the VA will cover it. Medicare is not going to be secondary to the VA. VA is not going to be secondary to Medicare. They do not work in conjunction with payment. If you do not enroll into Medicare and you have VA coverage, VA medical coverage is not considered credible with Medicare. If you go to the VA but you do not have Medicare Part B and you go to a civilian provider, you will not have coverage necessarily. I'll talk about one exception in a minute. But if you ever wanted Medicare in the future, Medicare Part B in the future, you would be charged a penalty because VA coverage is not considered credible with Medicare. Now there is a couple caveats. So if you have VA benefits, you need to get your care at the VA. That way your coverage or your health care covers your costs. However, in some cases, the VA may authorize a beneficiary to go to a non-VA facility or a civilian facility and still cover that cost. So I had a gentleman who needed to see a heart doctor rather quickly, but the VA wasn't able to get him an appointment as quickly as he needed one, so they gave approval for him to go to a non-VA facility provider to get that appointment that he needed, and the VA covered that because they approved it. So that's one way that they can work in conjunction, but they never work in conjunction in terms of payment. Okay, before I move on, I did have one question come into the chat box. So if you file taxes and have COBRA instead of Medicare, will you have to pay a penalty for not having credible coverage when you file taxes? Now, I think you're referring to the Affordable Care Act tax, the individual mandate. I don't know the tax penalty. Sorry, I'm going to see who put us on hold. There you go, mute that. Sorry about that. So I'm not sure how to answer your question because when it comes to tax penalties, I have no idea. I only know about if you have COBRA instead of Medicare and you need Medicare in the future, you're going to get a Medicare Part B penalty if you need it in the future. But I have no idea about the tax penalties. So I apologize, I won't be able to answer that question. All righty. The next coverage, TRICARE for Life. We do talk about this at our initial training a little bit when it comes to Part B eligibility. TRICARE for Life is for our retired military servicemen and women. And when I say retiree of the military, that means 20 or more years of service to be considered a retiree of the military. And Medicare always is going to pay first when it comes to TRICARE for Life, but TRICARE for Life is going to pay the rest. So it's just like a supplemental plan for our retired military servicemen and women. It's amazing coverage. If someone comes up to me and says, I have Medicare and TRICARE, as respectfully as I can, I thank them for coming to try and use our services, but the insurance that they have is the best that they can get, and I don't want to mess that up. Like I said, the rest of the services are covered, and they only need Medicare Parts A and B. That is what, when you're a retiree and you want to keep your TRICARE for Life, you have to have Medicare Part A and Medicare Part B. You don't need a drug plan, you don't need a supplemental plan, and you don't need a Medicare Advantage plan. If we enroll a beneficiary who qualifies for TRICARE for Life into any additional part of Medicare, we jeopardize them losing their TRICARE for Life benefits, and we do not want to do that. So again, someone comes to you who has TRICARE for Life, thank them for their service, thank them for coming to see if we can help them, but they have the best insurance that they can get, and we don't even need to do a comparison for them because their insurance, I'm very jealous of their insurance. They have wonderful insurance. Everything is paid for. 20% is paid for. Their drugs are paid for. They do not need any other part of Medicare. All right, so those are all of our medical health plans that we're going to be talking about, the health providers. Now we're going to switch gears a little bit and talk about prescription drug benefits in terms of all the providers that we've talked about. So again, keep those questions coming in if you have them. So the reason why we have coordination of benefits for prescription drug plans is to make sure that medications are being properly billed to Medicare. So we don't, just because you have a Part D plan doesn't mean every single medication necessarily goes to your drug plan. Generally speaking, Medicare usually pays primary if you have a Medicare drug plan, and it could be secondary if the plan denies a primary insurance claim or does one of those conditional payments, such as the liability insurance and things like that are taking a long time to process the claim. We did have another question come in that says, okay, you do need A and D for TRICARE, but no D. Is that what I'm hearing? Yes, 100% yes. For TRICARE for Life, only A and C, nothing else. TRICARE for Life is going to pay the prescriptions and going to pay the 20% Medicare doesn't pay. So yes, you have that completely correct. We've kind of already talked about this retiree, important information for retiree coverage. It's a very similar slide to what we've already talked about. But always, if a beneficiary comes to you and says, I have retiree coverage, make sure that they talk to their benefits administrator or their HR person so they know how their retiree coverage works with Medicare. There's so many insurance and retiree insurance coverages from employer plans that there's no way we'll be able to maintain a list or even have a list available to know the different retiree coverages. So the beneficiary is going to be responsible for talking to the benefits administrator about how it's going to affect their coverage, if they have family members on the coverage, how it's going to affect that. Retiree drug coverage is considered credible, so you don't necessarily need a drug plan unless your retiree coverage goes away. And if that happens, you do get a special enrollment period of 63 calendar days to get a drug plan through Medicare if your retiree coverage goes away. But it is very important that people don't necessarily just say, no, I don't want my retiree coverage, I want Medicare, because they could lose their entire retiree benefit and not be able to get it back. And it could jeopardize some of the insurance that family members may have through that retiree. So we have another question come in. Do they have to get RX at VA and not a pharmacy? When it comes to TRICARE for Life, and I assume that's what the question is referring to, whoever the drug provider for TRICARE for Life is probably is going to be through the VA, but they may have special circumstances if they aren't able to supply a medication for it to be picked up at a pharmacy. But generally speaking, for TRICARE for Life, they are going to be getting their medications through the VA. I'm sure special circumstances may apply, but general rule of thumb, they are going to get that through the VA. There's an exception to every rule, right? Okay. So this is a great chart, and it is a little confusing when you first look at it. So what this is showing us is the different types of the plan, the situation that you're in, and if you are currently enrolled into a drug plan, if it's going to pay primary or secondary. So going into this chart, already have in your mind that, yes, I have a drug plan through Medicare. You may not need it, but for the sake of this chart, we do have that drug coverage. So I have an employer group health plan, and you have retiree coverage. If you have a drug plan, it's going to pay primary, and your retiree coverage is going to pay secondary. Now remember, retiree drug coverage is considered credible, so the beneficiary may not need a Medicare drug plan right away. Again, these scenarios are if you have a drug plan as well. You're 65 or older with employer group health plan current employment, and your employer has less than 20 employees. If you have a drug plan, it's going to pay primary. If you have more than 20 employees, your group health plan is going to pay primary. Again, if you have any kind of coverage through an employer or through retiree coverage through an employer, you do not need a drug plan right away. Those are going to be considered credible coverage, And 9 times out of 10, the beneficiary may not have a drug plan since they have one through their employer or the retiree coverage. Same thing if you're under 65, that just has a different number of employees for the employer. So you have less than 100 employees, Medicare will pay first if you have a drug plan. More than 100 employees, the employer benefit will pay primary. COBRA, we've talked about COBRA a little bit. COBRA drug coverage, I used to think was credible, but I have not been able to find anything that has supported that claim that used to be in our training. So I do not believe that COBRA drug coverage is considered credible anymore. Now, it could be that COBRA, every insurance company sends the beneficiary a letter of credible coverage. So if COBRA is credible, they will get a letter saying, yes, you have credible coverage through COBRA. If that's the case, the beneficiary doesn't need a drug plan right away because they have that credible coverage. However, if COBRA is not credible, like a tongue twister, then they definitely do want to get a Medicare drug plan so they don't have any penalty. And then end-stage renal disease, employer is always primary until that 30-month coordination period ends, then Medicare becomes primary for both medical and prescription drug costs. Black lung programs, any medication having to deal with black lung disease is not going to be covered under Medicare. No ifs, ands, or buts. That's going to be billed through the federal black lung program. Indian Health Services, if you're able to get benefits through them, Medicare will pay first, even if you have your drugs through Indian Health Services or a tribal or urban Indian clinic. VA, we talked about VA. Again, there's no coordination of benefits when it comes to the VA and Medicare. However, the VA drug coverage is considered credible. So you don't necessarily need a drug plan if you're solely going to be getting your medications from the VA. If you're not and you want to go to a pharmacy down the street, then you need a prescription drug plan to go to that civilian pharmacy. State Medicaid, many of you know if we have a dual eligible beneficiary, dual eligible meaning the beneficiary has Medicare and Medicaid. Medicare is primary for all drug coverage, so you need to enroll them into a Medicare drug plan. There may be some exceptions if Medicare does not cover a medication, that Medicaid may cover it. I haven't come across any situation where that needs to happen. Usually we can find them a Medicare drug plan that covers all of their medicine more often than not. Of course, there's always those extreme circumstances. State pharmaceutical assistance programs, you need a drug plan because that's just assistance to help pay for a medication. It's not actually insurance. So make sure they have a drug plan. They'll still possibly qualify for those pharmaceutical assistance programs, but you have to have the drug plan for it to get covered. Workers' compensation, any medication related to the illness or injury on the job is going to be billed directly to that drug coverage through the workers' compensation. Medicare may make that conditional payment like we talked about earlier if the claim hasn't been paid by workers' comp within that 120-day period. Manufacturer programs, I know a lot of us use websites like MediMeds or RX Outreach to try and help beneficiaries find lower cost medications, maybe during the donut hole or something along those lines. You need to have a drug plan because that is not considered a drug plan if you're just going through an assistance program. Same thing if you're getting assistance from a charity, you need to have a drug plan. That way the medication is covered and maybe the charity is helping you pay that copay. No-fault liability insurance. Again, if I was in a car accident and I needed pain medication for my whiplash or whatever my injury was that happened as a result of that car crash, those need to be billed to the liability insurance. But anything in addition, that maybe some maintenance medications needs to be billed to your prescription drug plan. So it is important that you have a Medicare drug plan with that no fault as well. Alrighty, and here's a lot of resources for you. I did include, Office of Personnel Management. There you go. See, I knew it was in here somewhere. So this is the link that I provided for some more information on federal employee health benefits. There's our RX assistance. They did have a couple, it might be on the next slide, but black lung disease, VA, Medicare TRICARE overview. So you have a lot of resources at your disposal if you have questions on coordination of benefits. I just had a chat box come in with a bunch of 3s, so I think that might have been an error and not a question. There's also some Medicare products, and I did attach these to the email that I sent out to everyone who's RSVP'd. I did not attach the Medicare New Handbook. Everyone should have that either from initial training or training that happened during open enrollment. If you do not have a 2018 Medicare New Handbook, please let me know and I can get you one. In the email, I included the Your Medicare Benefits. That's like 60 to 80 pages. So if you printed that off, tried to warn you. It's a good general kind of secondary to the Medicare New Handbook resource to have. One of the best resources, in my opinion, that we have is the Who Pays First manual. That was also attached, and that really helps with coordination of benefits. I use it all the time when someone asks me about a coordination of benefits issue. Here are some acronyms that were used through the presentation. I try not to use acronyms as best I can, but if I did, and I apologize, here is what all the acronyms mean throughout the presentation today. So you have the reference there. And before we talk about the survey, I don't have any other chat questions that came in, but I'm afraid I don't want to open it up. I'm not going to unmute everyone, but, ooh, so sorry. I accidentally ended the presentation and I did not mean. Let's go back. There we go. Sorry about that. So if anyone has any questions, you do have a hand sign by your name. If you look at the participation list, you may want to maybe raise your hand and I can unmute your line. Or if anyone has any questions, you can feel free to start talking and see if you're unmuted. Or again, the chat box is open as well if you have any questions about the presentation. All righty. Oh. Nope. No. I thought I saw a hand, but the hands went away. All right. I don't see any hands raised. So what I'm going to do is I'll talk about the webinar, and then I'll stop the recording and see if anyone has any questions. Oh. And let's see. So the webinar, everyone has the webinar from the PowerPoint that I sent in the packet of information before the webinar. So please, please, please fill out the link or fill out the survey so I know what needs to be done better, or if you have suggestions on topics or how I could be better doing the webinar, please fill out the survey for me. I will also be sending up a follow-up email to everyone by the end of the day that will have the webinar or the survey link. And then if you had to leave, I know we had a couple of people say that they may have to leave a little bit early. The webinar will be posted by this afternoon to our Tennessee SHIPSMP YouTube channel, so feel free, if you need a reference later on, that you can look on our YouTube channel and be able to look at that at your leisure. So again, thank you so much to everyone who joined the webinar today. There's my contact information. Feel free to call or email me if you have any questions anytime. I will let you know that travel is starting to pick up quite a bit for me with trainings and things. So email is probably going to be the best form of communication for a long time. But anytime you need to give me a call, feel free to leave me a message and I'll get back to you as soon as I can. We did have a question, what is the best way to get hard copies of the 2 booklets? shoot me an email, and I'm happy to mail you those booklets if we have some copies in the office. I know we have a lot of copies of the Who Pays First. I'm not 100% sure if we have any of your Medicare benefits, but I can always order those and I can get those over to you. Just send me an email, and I'm happy to send those hard copy. And with that, I'm going to end the recording.